3. Managed care, how to understand and assess it. I. Needs identification. Self-managed, health insurance provider, self-insured, outsourced, company clinic, personnel, facility, medicines and supplies, outpatient medicines, inpatient, outpatient consultation, labs and diagnostics. Ask AI. Alt. 2. Financial risk-taking. A. Self-management. The company takes on the responsibility of providing the healthcare services of the employees. Clinic management, outpatient and inpatient services. Administrative and servicing activities are involved. Is the company capable of providing healthcare services to its employees? Considerations. Knowledge in healthcare management. Financial capability. Risk management. Personnel/team. Facilities/equipment/supplies. Provider network. Others. B. Self-insurance. Self-funded health plan established by an employer as its own legal entity, similar to a trust. The company or individual sets aside a pool of money to be used to remedy an unexpected loss. Comes with a high level of risk and liability. May be part of self-management. C. Outsourcing. Involves the contracting out of a business process and operational, and/or non-core functions to another party. For healthcare services. Clinic management. Medicines. Outpatient and inpatient services. Advantages. Reducing and controlling operating costs. Improving company focus. Gaining access to world-class capabilities. Freeing internal resources for other purposes. Streamlining or increasing efficiency. Maximizing use of external resources. D. Health insurance provider. Indemnity insurance. Reimburses you for your medical expenses regardless of who provides the service. This is the coverage offered by most traditional insurers. Different plans use different methods to determine the amount you will receive for your medical expenses. Most common methods. Reimbursement actual charges. The insurer will reimburse you for the actual cost of specified procedures or services, regardless of how much that cost might be. Reimbursement percentage of actual charges. The insurer pays a percentage of the actual charges for covered procedures and services, regardless of how much those procedures and services cost. A common reimbursement percentage is 80%, 20% copayment. Indemnity. The insurer pays a specified amount per day for a specified maximum number of days. Although your reimbursement amount does not depend on the actual cost of your care, your reimbursement will never exceed your expenses. Managed care, HMO. Involves an arrangement between the insurer and a selected network of healthcare providers, doctors, hospitals, etc. All offer policyholders significant financial incentives to use the providers in that network. 3 basic types. 1. Point of service, POS, plans. No deductible and/or minimal copayment. Doctors/providers have no restriction with patient/account acceptance. Member is free to choose their doctor and provider, hospital/clinic, within the POS network. If availed outside the POS network, member may then likely be subject to a deductible and/or copayment may be a substantial percentage of the physician's charges. 2. Preferred provider organizations, PPOs. Group of doctors and providers that offer medical service to a specific group or association. Members pay for services as they are rendered. Members reimburses for the cost of the treatment, less any copayment. The price for each type of service is negotiated in advance by the healthcare providers and the PPO sponsor, S. 3. Health maintenance organizations, HMOs. Prepaid medical treatment. Members pay a fixed monthly fee, regardless of how much medical care is needed in a given month. Provide a wide variety of medical services. Members avail within the HMO network. Rates of services are negotiated in advance. 3. Assessment objective. Value for money leftward arrow rightward arrow to obtain the most responsive benefit package, with the best service delivery, at the most reasonable cost from a reliable company. Ask AI. Alt. Possible evaluation criteria for health insurance providers. Company profile. Am I dealing with a reliable and reputable company? Owner/S, management composition. Number of years in the business. Clients. Number of enrollees. Business growth. Financial history and status. Credit standing with provider partners. Regulatory standing, SEC, BR, etc. Health benefits covered. How comprehensive and appropriate are the health services provided? 1. Services. Outpatient, inpatient, emergency services. Medicines. Dental. Annual checkup. Wellness program. Other administrative and non-medical mutual benefits. What are the inclusion/exclusion/limitations of coverage? 2. Coverage. Pre-existing conditions. Demographic limitations, age, location, etc. Effectivity of coverage. Dependent coverage. Others. Service delivery organization. How vast and competent is the network? Reputation of affiliated providers. Geographic location/coverage. Census. Provider, hospital/clinic, services. Types of affiliated facilities. Diversity of physician specialties. Provider relation status. Price, or premium. Is the premium charged reasonable and competitive as with others? A. Per capita rate. B. Pricing policy. Experience rating vs community rating. Cross-subsidy among companies. Hazardous with or without non-hazardous pricing. Young vs old workforce. Workforce geographic location. C. Premium allocation. Expenses as percent of premium. ASCII. Alt. Availment procedures. What are the policies and procedures for availment? Are policies existing particular to availment procedures? Quality assurance of services to be or have been rendered. Customer satisfaction. Health system coordination. How responsive are they in addressing administrative concerns? Origin of concerns. Member. Provider partners. Internal. Company client management. What is the extent of the back office processes? Are they established? How refined/sophisticated are they? Automated/manual. Track record of responsiveness and solution provision. Others. Utilization management. Utilization reports. Availment data gathering and sorting. Analysis of availment behavior in relation to cost. Determine trends/behavior. Recognize data outliers. Identify fraudulent behavior. Provide recommendations. Reduction and control of unnecessary utilization. Program interventions. Illness prevention/wellness programs. What are the strengths and weaknesses of the current health plan? Conduct periodic feedback programs. Gather insights with regard to healthcare plan benefits. Health plan provider. Services rendered by provider network. Administrative service of insurance provider. Are the members happy with the healthcare program? V. Conclusion. 1. There is no perfect health benefit system. Value trade-off is sometimes required or necessary. 2. Choice of insurance provider is highly dependent on what is/are most important to the company. Exercise prioritization. Priority items is/are given more weight. 3. Full cooperation of company management in the healthcare plan execution is required. 4. Knowledge on healthcare system management is essential.